Now the next topic is fissure in ano. It is a longitudinal ulcer in anal canal or at the anal verge. The usual positions are either 6 o'clock position, which is posterior, or either 12 o'clock position, which is anterior, that is 6 and 12. The other position can also be there. In that case, you should suspect some secondary cause for the fissure in ano. Now this position is with respect to the pubis symphysis. Pubis symphysis is considered as 12 o'clock position, opposite as 6 o'clock, then accordingly we classify the positions. It is more common in female than male. Usually it is equal in both the sexes, but if we compare, it is slightly more in female. In female, anterior hemorrhoids are 10%, in males it is 1%, which means mostly there are posterior hemorrhoids because of some anatomical factors. 6 o'clock position is more than 12 o'clock position. Obviously this is almost 90%, this is 10%. You can see this. It is painful condition. The symptom can be bleeding, which is painful, which is associated with constipation, and mucous discharge can also be present. The per-rectal examination is not possible due to severe pain, though chronic fissure can allow per-rectal examination, which is less painful. So this is pubis symphysis, this is scrotum, this is 12 o'clock, this is 6 o'clock. There is a fissure which is breach in the skin, which is at 6 o'clock position. The causes can be heart stool, constipation, or multiple episodes of diarrhea, increased internal sphincter tone, local ischemia, or trauma. There can be secondary causes like sexually transmitted disease, ulcerative colitis, and tuberculosis. Types can be acute and the chronic. The acute one, deep tear in the lower skin with severe sphincter spasm, which is quite painful. There is no edema, inflammation. Treatment is conservative and loss dilatation. The chronic anal fissure, central piles is present. Inflammation and edema is present. It is less painful than acute fissure. And treatment is symptomatic plus sphincterotomy, which can be dorsal or lateral. The treatment overall, medical management same as that of hemorrhoids. You know that. Plenty of fluids, high fiber diet, stool softeners, lactose, chlorpheniramine, local anesthetic, which is lignocaine. In this, you can also use diltiazem 2%, which is LABD. LABD means twice daily. Glycerin trinitrate can also be used with 2%, applied 4 times a day to the anal margin. You should take precautions because this can cause headache. So if the patient is hypertensive, you should be cautious of using GTN. Sitz bath. This is very important thing which can be used in this, which should be used in this, which must be used in this also. Then treat secondary cause if present. What is loss dilatation? Loss dilatation is manual dilatation of anal ring using 4 fingers of each hand, which means 8 fingers, to cause vigorous stretching of the anal canal to break the circular constructed bend in the wall of anorectum, done in either general or spinal anesthesia. There is a term which is dorsal fissurectomy with sphincterotomy. In this, we do fissurectomy and send the specimen for biopsy to blood carcinoma, tuberculosis. The transverse fibers of internal sphincter are divided in the floor of the fissure. One term is lateral sphincterotomy, which can be either closed or open. Sphincterotomy indented below the dentate line. In closed method, number 11 blade is used, which is inserted into intersphincteric groove. Intersphincteric groove is between internal sphincter and external sphincter. Then we rotate the blade medially to cut the 1/3 or the 1/2 of the internal sphincter. In open method, skin is incised laterally. Then we reach the internal sphincter and then cut it under vision and leave the wound open. There is one more method, which is anal advancement flat. In this, after excision of the edges of the fissure, if necessary, Its base overlying the internal sphincter and everted heart-shaped flap of the perianal skin is carefully mobilized with blood supply intact without tension to cover the fissure. This leads to healing of the fissure and you can say cure. And then it is sutured with interrupted absorbable sutures. This was whole lecture. Thank you so much.